Hi everyone, my name is Danielle Couturiaux and I am the data manager for the School Health Research Network. In this presentation, Rydian and I will discuss how SHRN has encouraged research engagement in health and education systems in Wales and the impact this has had on schools and pupils. Established in 2013, the School Health Research Network brings together secondary schools, academic researchers, policymakers, and practitioners from health, education, and social care to improve young people's health and well-being in the school setting. With the aim of building capacity for evidence-informed practice within health and education systems, every 2 years, network schools are invited to take part in the Student Health and Wellbeing Survey. In return, each school receives an individualized student health and well-being report containing their survey results, benchmarked with national data for comparison. The report includes the latest research findings on different health topics, links to supportive agencies, and suggested whole school approaches. The network has grown over the years, and since 2017, all of the maintained mainstream secondary schools in Wales have become part of the SHRN network. In 2019, over 119,000 students from 198 schools participated in the Student Health and Wellbeing Survey. To measure the impact SHRN has had on health and education systems, we have been collecting qualitative and quantitative evidence to explore how schools have used their SHRN data. SHRN has facilitated evidence-led whole school approaches to health and well-being practices, contributing to measurable change in student health and well-being. The Student Health and Wellbeing Survey results have helped raise awareness of the health concerns students might be facing. It has allowed schools to identify, prioritize, and address areas of need. Using their Student Health and Wellbeing report, schools have been able to revise and tailor their school curriculum to meet the well-being needs of their pupils. The Student Health and Wellbeing Survey has provided schools with the quantitative evidence they need to measure and assess whether any changes they have implemented in the school have had an effect. During this past year, SHRN has been piloting a teacher secondment with Rydian Jones, the Health and Wellbeing Lead in Ysgol Aberconwy, a secondary school in North Wales. SHRN has benefited immensely from having the perspective and expertise of a practicing teacher with senior leadership experience on SHRN activities. I would now like to hand over the presentation to Rydian, who will be sharing his experience of SHRN and the impact it has had on his school.
Firstly, diolch and thank you for this opportunity to discuss the impact that the School Health Research Network has had at Ysgol Aberconwy Secondary School since 2013. I'm Mr Rydian Jones from Ysgol Aberconwy in Conwy, North Wales, and back in 2015 I used the new curriculum guidance and our school SHRN reports to justify the need to appoint a school health and wellbeing coordinator. I believe that the ability to fulfill this role without the traditionally associated safeguarding and child protection responsibilities has been crucial to some of our most recent school successes. We have been involved with SHRN since the very beginning, as a part of their pilot study. What was so significant was that for the very first time we had school-specific facts, figures and data for what was often seen as a bit of a woolly subject. As a result of our partnership with SHRN, we are now in the enviable position of being able to monitor school-specific trends from when students begin in Year 7 to 7 years later when they leave in Year 13. We are now also able to monitor the long-term impact of the initiatives and interventions we have implemented with specific groups, as well as on a whole school basis. So, for context, Ysgol Aberconwy is a PFI school, and for as long as I can remember, the mighty money-making vending machine was a major cause of personal stress and frustration. For the very first time back in 2013-14, SHRN data was providing us with evidence for what we had long suspected, that having easily accessible and healthy food and drink choices on the school site was a contributing factor that was having a negative effect on our students' health and well-being. When water fountains replaced the vending machines at Ysgol Aberconwy, this was our first big win, and demonstrated the potential power of SHRN reports data. As luck would have it, during that summer, I was able to source Dŵr Cymru water bottles at the National Eisteddfod, and our School Nutrition Action Group helped to distribute them to our new intake Year 7s. Our long-term partnership with SHRN has allowed us to track a 47% decrease in the percentage of students that drink one or more sugary drinks a day since 2015. I strongly believe that our SHRN-informed interventions has been a catalyst for this shift. It has since been brought to my attention that this water fountain policy was adopted at the other two PFI schools in our county, who have also subsequently recorded 42 and 38% reductions in their sugary drinks consumption during this same time period. Which brings us to the 2015-16 survey and the first data set we shared more widely with our significant other external partner agencies. One of the most positive outcomes from this round of results was the establishing of PLCs that focus exclusively on staff and student health and well-being. Membership to our PLCs range from sport ambassadors to school governors, and from local authority staff to the manager of our PLC. This was also the year that we started a whole school cross-curricular project between the ICT department and our new project-based learning programme, focusing on good sleep health. This involved viral social media campaigns and key sleep health messages being displayed on all student and staff computer desktop wallpapers and screensavers. As you can see, this campaign had a notable impact on our results, especially when you consider that the All Wales data only fluctuated between 26 and 22% during the same time period. Since 2017-18, I have championed a preventative rather than a reactive approach to health and well-being whenever possible at Ysgol Aberconwy. We noted that mental and emotional health concerns were affecting more and more of our younger students. SHRN data has justified our decision for earlier mental and emotional health education, awareness and intervention, even as early as our Year 5 Happy Theme Transition Programme. In 2017, we used the SHRN model to survey the health and well-being of all school staff for the first time. Recent findings have resulted in the creation of a 24/7 electronic suggestion box, no meeting well-being weeks, and sound baths, amongst other activities. Which now brings us up to receiving our most recent SHRN report during these most uncertain of times. We immediately noticed some worrying result spikes when comparing these most recent results with our historical trends. I'm not sure if it had more to do with being a school health and well-being lead during a global pandemic or being home 24/7 with a 1 and a 3-year-old, but it took me far too long to account for the impact that including Year 12 and Year 13 sixth form students for the first time would have on these sets of results. When you factor in the various complexities and greater freedom these older students tend to have, then I would say these results should be expected. But it is also encouraging to note how in other areas we are clearly equipping our students with the necessary knowledge and understanding to make positive and informed lifestyle choices. Next year, we look forward to launching our new Health and Wellbeing project-based learning lessons, which will allow us a total of 64 hours of cross-curricular teaching and learning for all our new intake Year 7 students. Whilst planning for our new normal return to school, we have made extensive use of SHRN research papers, reports and blogs to ensure that we are making evidence-informed decisions on our health and wellbeing strategy, priority needs and future direction that focuses on the needs of our whole school. Our SHRN evidence-informed health and wellbeing strategy was highly commended by the Healthy Working Wales assessors when we became the first secondary school in Wales to achieve the Corporate Health Wales Award. SHRN also provides us with the necessary school, consortia and national level data to prove the effectiveness and impact of our interventions during health and wellbeing audits and inspections. One of my proudest health and wellbeing achievements is how we successfully used SHRN data to justify the establishment of our new iach health base at Ysgol Aberconwy. This wellness space offers a no wrong door area for our young people and staff that may need support with their health and wellbeing. My hope is that the iach room will prove to be a legacy that will continue to benefit the health and wellbeing of staff and students at Ysgol Aberconwy for many years to come. So, in conclusion, during my 7 years involved with SHRN, I have learned the hard way that the one-man band model does not work, and you need to recruit a strong and committed health and wellbeing team to drive your health and wellbeing strategy. Secondly, you must make use of the regional and national SHRN reports to help avoid going off on wild tangents and to allow you to place your survey results into real context. And finally, whenever possible, try to be proactive whenever possible to avoid getting sucked into constantly firefighting and having to respond to the latest health and wellbeing concern or priority. Thank you very much for your time a diolch am wrando.